So this is a pediatrics practice quizzes. So the first one is, which vaccine is typically administered first in the newborn? Which vaccine do we give when a baby is born? So we have all the option, and varicella, DTaP, hepatitis B, measles, mumps, rubella. The answer is hepatitis B. That is what we usually give at birth. What is the most common cause of bronchiolitis in infants under 2 years of age? We mentioned bronchiolitis, and I also mentioned that you need to take note of the virus that causes it. So the answer is respiratory syncytial virus, RSV. RSV. So RSV is the leading cause of bronchiolitis in infants and young children, especially during winter months. Which condition is characterized by barking cough? We mentioned this, barking cough and inspiratory stridor in children. So if you mention croup, that is the answer. We say that in epiglottitis there is no cough. What we have in epiglottitis is drooling of saliva, because we say that it's a medical emergency. If you don't take care of it, you can close their airway, and the treatment for epiglottitis is antibiotics. And in epiglottitis, we have what we call the thumb sign. But in croup, you have that barking sound, barking cough, and under the treatment for croup, we say that it is one-time steroid injection, dexamethasone, and also we have the staple sign. So croup is caused by influenza virus. It presents with a barking cough and inspiratory stridor due to inflammation of the upper airway. What is the first line treatment for otitis media in children? What is the first line? Clindamycin, amoxicillin, azithromycin, ceftriaxone. So if you say amoxicillin, you are correct. But also know that if you don't see amoxicillin, if you see cephidenia, if you see um, cephidenia, which is omacef, then it's still correct. What is the most appropriate initial treatment for moderate? Remember, we didn't say minor. For moderate group, that means that this person is having more symptom than usual. So the answer is dexamethasone. Okay. We have intravenous fluid, we have oral antibiotics. We don't treat croup with antibiotics. Nebulize albuterol if they have a bronchospasm, but for a moderate group, that means they are constantly having those symptoms, you can treat it with dexamethasone. Which of the following is a red flag for developmental delay in a 2-year-old? What are remember we talked about the developmental and delays, the ones that are red flag, not speaking any two words, because we said that by 1 year they should be able to speak one word like mama, dada. So when this child is 2 years old and they are not able to be able to use speak like 1 to 2 words, then there is an issue. For 2 years old, they should be able to speak at least two-word phrase. What is the most common cause of bacterial meningitis in under 3 months? The answer is group B streptococcus. Group B streptococcus. Which condition present with sandpaper rash? We mentioned it here. Sandpaper rash and strawberry tongue, measles, Kawasaki disease, rubella, scarlet fever. If you say scarlet fever, you are correct. Remember when I differentiated between scarlet fever and Kawasaki disease, I said that both of them have strawberry tongue, okay? Desquamation of the skin, like their skin is peeling. But the difference is in scarlet fever, they have sandpaper rash. And in Kawasaki disease, that is the only condition that we are allowed to use aspirin in children. Measles, you can compare it with rubella. I said that measles has the three prodrome, which is your cough, conjunctivitis, and cohaza, which is the congestion. Those are the three prodrome. But you don't have those prodrome in rubella. Rubella is also called your German measles, and we say that is a 3 days and 3 days fever. And in measles is more severe than rubella. So please listen to those videos again and be able to know the difference. But for this question is asking you patient presenting with sandpaper rash, that is scarlet fever. Which vaccine is contraindicated in a child with severe egg allergy? Which vaccine is contraindicated in a child with a severe egg allergy? Influenza, hepatitis B, MMR, and varicella. Please take note of this. The answer is influenza. It is contraindicated in children with severe egg allergy due to the risk of anaphylaxis. What is the most common cause of acute gastroenteritis in children? We talked about this one. What is the most common cause of acute gastroenteritis? So the answer is what? Rotavirus. We said it. Rotavirus is the most prevalent worldwide. Rotavirus. Which of the following is a sign of dehydration in infant? Which of the following is a sign of dehydration? You know, bulging fontanelle, dry mucous membrane, bradycardia. So bradycardia is not typically seen in dehydration. So if you answer dry mucous membrane, that is correct because that is a sign of dehydration. Bulging fontanelle will be a sign of increased intracranial pressure. They didn't say sunken fontanelle. They said bulging fontanelle. And dry mucous membrane is the answer. Which condition is characterized by a staple sign? Staple sign, we have mentioned this. The answer is croup. Croup is where you have staple sign, but thumb sign is where you have epiglottitis. What is the most appropriate for Kawasaki disease? What is the most appropriate treatment for Kawasaki disease? We have talked about it. Kawasaki disease, the treatment is the only place we are allowed to give aspirin, and we also give them intravenous immunoglobulin. It helps to reduce the inflammation and prevents the coronary artery aneurysm. So Kawasaki disease is treated with these two, especially the aspirin or intravenous immunoglobulin, to reduce that inflammation and prevent coronary artery aneurysm. Which of the following is a classic sign of pyrolic stenosis in infant? Pyrolic stenosis. We mentioned pyrolic stenosis, and we said that in pyrolic stenosis we have that projectile vomiting, and it is non-bullous vomiting. It is non-bullous vomiting, okay, or bilious vomiting. So projectile vomiting, olive-like mass, non and poor weight gain or poor growth. So that is your, where do we have a, what is the classic sign of pyrolic stenosis? That is the projectile vomiting, because they have obstruction. So whatever they eat, they tend to vomit it. Which of the following is the most common cause of acute otitis media in children? That will be the organism is talking about, and that is your strep pneumo. Which of the following is a sign of depression? We have talked about this. So bulging fontanelle, dry mucous membrane increase during output? So the answer is dry mucous membrane. Dry mucous membrane. We have talked about this. Which of this is the most common cause of gastritis in children? That is rotavirus. And which of these is contraindicated in children with severe egg allergy? That is influenza. So please, if you can do more questions from your book, that will be very helpful. Any other question?